So I was based in St James's Hospital with Trinity College Dublin, and I looked at a group of esophageal cancer patients and looked at the insulin-like growth factor pathway in this group of patients, and I compared the expression of this pathway in patients who were obese versus patients who were of normal weight. I found that this axis did seem to be overexpressed in patients who were obese, which makes us think that it may be a factor that drives cancer progression in patients who are obese with esophageal cancer. And when I looked in cancer cells, I found that when you targeted this pathway that you could kill the cancer cells, which opens up the potential for drug treatments. I looked at the esophageal cancer patient tumours once they had been taken out of the patients, and in over 200 patients that we have all of the clinical information on and the follow-up data, I looked at the expression of insulin-like growth factor pathway proteins in it, and I compared the outcomes for patients who were overweight and obese versus patients who have normal body weight. When I compared the presence of the insulin-like growth factor receptor in tumour cells, I found that there was more of this receptor in patients who were overweight or obese versus patients who were normal weight. This pathway has never been looked at in esophageal cancer before, so it's of importance to patients potentially with esophageal cancer in the future. And also the mechanisms that link how obesity drives cancer progression haven't really been clearly studied before, and this area of research interest hasn't been looked at before. The Irish Cancer Society are unique in funding medical researchers such as myself, who are doctors in training, to take time out of their career progression and to look at an in-depth research question in detail, and this is really of benefit to both ourselves and the patients that we work with.